A pleasant day to each and everyone. Today I will discuss to you the Module 9, that is the first aid with CPR. Objective of this: define first aid, give the importance of first aid, know the first aider's rule and guidelines for giving an emergency care, give the golden rules of emergency rescue, know the characteristic of a good first aider, identify the different emergency situation and give, then perform different bandaging and transportation of victim, then demonstrate CPR of adult, child, and infant. Okay, that are the objectives of the module. Then, what is first aid? Okay, first aid is the initial emergency care given immediately upon arrival at the scene to an ill or injured person. Okay, as we can see, okay, a first aid, this is the first or initial emergency care given upon arrival at the scene. Okay, this is ito yung sinasabi nating paunang lunas. Paunang lunas doon sa taong may injury. Okay? Then, what are the first aider rule? Okay? First is to preserve life. When we say preserve life, okay, dito yung the first aider is pinapanatili niya yung buhay ng may injury or kailangan yung kaligtasan ng may injury. Okay, then protect the unconscious casualty. You must protect the unconscious person. Okay, then prevent the condition from worsening. Kailangan, as a first aider, you can prevent the injured part from worsening. Okay, kung yung injured part lang is medyo kaya pang gamutin, okay? Wag mong, kung yung injured part is hindi malala, kailangan wag mo nang palalain pa. Okay, that is the first aid rule. Then, promote recovery, and the last one is the call for medical assistance. As a first aider, if you cannot give the emergency care for the victim, okay, kung hindi mo na siya kayang lunasan, okay, you must call for the medical assistance. Then, what are the 8 points of emergency? The 8 points of emergency, first is rescue the victim and yourself. When we say rescue the victim and yourself, kailangan protektahan mo, rescue mo yung victim as well as yourself. Hindi yung i-rescue mo yung victim pero yung sarili mo hindi. Okay? Paano mo ma-rescue yung victim kung yung sarili mo nga hindi mo ma-rescue? Okay? Kailangan you must rescue the victim and yourself. Okay? Kung yung biktima is, next is restore or maintain breathing and circulation. Okay? Control bleeding and apply pressure. When you can see the injured part, you must control bleeding and apply pressure. Then treat for poisoning. Then prevent shock. Activate EMS. When we say EMS, this is the emergency medical services. Okay, then examine the victim from head to toe. Okay, you must check the victim from head to toe kung nasaan yung injured part niya. Hindi yung sinabi mo sa ulo ay sa paa yung may injured part pero nasa ulo pala yung other injured part. Kailangan you must check all the injured part of the victim. Kailangan unahin mo yung mas malala. Okay, yung mas malala, kung mas malala is nasa ulo, kailangan unahin mo yung injured part na nasa ulo. Okay, then monitor the vital signs of the victim. The golden rules of emergency rescue. The dose, okay, first is do obtain consent if possible. Okay, kailangan you must ask for the consent of the victim if possible. Okay? Kailangan kumuha ka muna ng consent sa victim kung papagalaw ba yung sugat o hindi. Then, remember to identify yourself. As a first aider, you must show or pakita mo any of your identification doon sa victim. Kailangan magpakilala ka na ako si a first aider, okay? Kailangan you must identify yourself. Then, provide comfort and support. Then, respect the victim's modesty and physical privacy. Okay? Then, be as calm, as direct as possible. Okay? As a first aider, kailangan kalmado ka lang. Okay? Kalmado kang nilalagyan ng paunang lunas yung injured part ng victim. Hindi yung ikaw pa yung unang nanginginig. Okay? Kailangan you must be calm. Then, care for the most serious injury first. As I said, you must check all the injured part. Then, you must care for the most serious injury of the victim. Hindi yung sugat lang na konti sa kamay, yun na yung nakita mong yun yung nakita mong injury, pero sabi ko kanina, meron pa sa ulo, mas malala sa ulo. So you must check, okay, all the injured part of the victim. Okay, then assist the victim with his medication. Then keep lookers away from the injured person. O yung mga bystanders o yung mga chismosa, kailangan paluin natin sila doon sa victim para kailangan ng victim yung hangin. Okay? We must keep lookers away. Then, handle the victim to the maximum care. Then, loosen tight. Okay? Kailangan luwangan natin yung mga kailangan luwangan. Okay? The don'ts. Okay? The don'ts for the golden rules of emergency rescue. First, do not think for the worst. Huwag mong isipin yung malala, nawalala yung situation niya. Then, do not further harm the victim. As a first aider, kailangan i-secure mo siya. Okay? Huwag yung nilalapit mo siya sa harm. Okay? Kailangan i-secure mo siya. Then, do not let the victim see his injury. Okay, do not let the victim see his injury. Kailangan wag mong ipakita sa biktima or sa injured person yung kanyang injury or yung sugat niya. Okay, may possible yan na pwede siyang mag-collapse or mahimatay. Okay, do not leave the victim alone. As a first aider, do not leave the victim alone. Wag mo siyang iiwanan. Okay, do not assume that the victim obvious one injury. Then, do not give water or anything by mouth. It may cause choking. Okay? In the motorcycle accident, if that person is unconscious or gusto niyang uminom ng tubig, wag niyong papainumin ng tubig. Kasi may possible niyan na pwede siyang ma-choke. Okay? Magkakaroon siya it may cause choking. Any vehicular accident, kailangan or kahit na anong aksidente man yan, kailangan wag nating bibigyan ng tubig or anything by mouth kasi pwedeng mag-cause ng choking. Okay? Do not make unrealistic promises. O wag kang magpa-promise sa biktima na, for example, naputol na yung kanyang paa, okay? Baka mamaya, pwede pa yang maibalik. Okay? Do not be unrealistic promises to the victim. Then, do not trust the judgment of a victim. Kasi, yung unconscious pa yan, wala pa sa tamang isip kung mayroon siyang or nagkaroon ng aksidente. Okay? That is the don'ts for the golden rules of the first and the characteristics to be a good first aider. what are the characteristics? That is what we call the Mr. G. Castor. On the Mr. G. Castor, first is gentle. Bakit sinabi natin gentle? Okay? Kailangan kailangan banayad lang yung paglalagay mo ng care doon sa may injured part niya or dahan-dahan yung paggamot sa kanyang injury. Then, careful. Okay? A for alert. As a first aider, kailangang alerto ka. Okay? Then, sympathetic. Okay? Then, tactful. Yung sinabi nating tactful, maiintindihan mo yung situation ng may injury or the victim. Then, as a first aider, you must be observant. Kailangan na-observe mo yung situation ng isang victim. Then, resourceful. As a first aider, kailangan maging resourceful ka kung ano yung nakita mong pwedeng panggamot sa kanya or pwedeng may lagay sa injured part niya, gamitin mo. Kailangan maging resourceful ka. Kaya first aider must be a resourceful. Okay, that are the characteristics to be a good first aider. That is the Mr. G. Castor. Then, types of wounds. Okay, a wound is a break in the continuity of the tissue of a body, either internal or external. Okay? Yung sinasabi nating wound, that is yung sugat dito sa labas ng part ng katawan or doon sa loob ng katawan natin. Okay? There are 4 types of wound or what we say, yung sinabi nating classification of wound, that is the open and closed wound. When we say open wound, okay, a break or ito yung sugat on the skin or a break on the skin or in the mucous membrane. That is the open wound. The other one is the closed wound, that is the underlying tissue. Okay, without the break of the skin. Sa closed wound, yung doon sa loob ng katawan natin na hindi nakikita sa labas. Wala siyang break na nakikita doon sa skin. But inside of your underlying tissue, may sugat siya sa loob. Okay? Okay. In the closed wound, for example of this is yung black eye. Okay, that is the example of the closed wound. Then, next is the type of wounds. There are 4 or 6 type of wounds. Okay, the first one is the abrasion or the abrasion, there is the scrubbing or rubbing in the rough object. Okay, next is the incision or the incision, it may get on the sharp instrument. For example, is the knife. Okay, that is the sharp instrument. The next one is the laceration or yung cut. Then, punctured may caused by the pointed object. For example, the nail, yung pako, ice pick. Okay? That are the object that may cause punctured. Then, next is the amputation. Yung amputation na sinasabi natin, it may cause cutting of the parts of your body. Then, the abortion may cause by vehicular accident. Okay, that are the types of. Then, how we can control the open wound or the closed wound. First, okay, cold application. Okay, kailangan lagyan mo ng cold compress. Okay, you must give direct cold compress. Then, elevation. Kung may sugat sa may kamay, kailangan itaas mo, mas mataas sa yung puso. Kasi para mag-stop yung bleeding niya. Okay, that is the elevation. Okay, you must elevate the injured part of your hand. Okay, kailangan mas mataas sa puso. Okay, then pressure bandage. Okay, kailangan yung mas pressure on the supplying artery. Okay, yung may sugat, kailangan yung mas give the pressure bandage para ma-stop yung pag-bleeding. Okay, that is the how to control bleeding. And the other one is the dislocation. Okay, dislocation is a bone comes out of place. Okay, this is on the picture show the dislocation of the knee. Okay, the joint of your knee kaya nagkaroon ng nag-dislocate siya na hiwalay doon sa kinadudugtungan niya. Okay, that is the dislocation. The signs and symptoms, first is nandoon yung kirot. Okay, then the swelling, pamamaga, discoloration, nag-iiba na yung kulay niya, inability to move, hindi mo siya maigalaw. Okay, once you are dislocate, hindi mo na siya pwedeng maigalaw. Mahihirapan kang igalaw yung injured part niya. Then the first aid for this is immobilize the affected area. Okay, immobilize the affected area. Kailangan hindi gumagalaw yung affected area na. Then place a splint. Sinasabi nating splint, yung pwedeng gawin yung dalawang kahoy, magkabilaan. Then apply cold compress. You must put the cold compress on the affected part of the victim. Then elevate and use an arm sling. Okay, nakikita natin na nilalagay sa kamay, that is the arm sling. Then have the rest. Okay, that are the first aid for the cramps usually cause. Okay, ito yung nabibinat yung mga muscles natin. It may cause cramps. Nagkukos ang cramps pag nag-over fatigue na yung muscle natin. Okay, the sign and symptoms of this is pain, tightness of the muscle. Masakit yung muscle natin. Yung, di ba, sa paa pag nagbabasketball kayo, yung muscle mo, pag nag-over fatigue na yan, tumataas yung muscles niya. Okay? Then the first aid for this, ano ba yung pwedeng gawin pag nagkaroon ng cramps? Okay, gentle stretch of the affected part or the affected area. Kailangan i-stretch mo yung affected area niya. Then application of cold compress, then massage it. Kailangan you must apply the cold compress, then after that you must massage the injured or affected part of your muscles. Okay, that is the first aid for the. Then next one is the sprain. The sprain is the stretching or tearing of ligaments. Okay, ito yung kakaroon ng sinasabi nating nag-twist yung ankle mo or nag-twist yung ligaments mo. Okay? The tough band of fibrous tissues that cannot two bones together in your joint. Okay? The most common location for sprain is in your ankle. As I said, ito yung nag-twist kayo. Pag once na, for example, yung sa Tagalog is yung naligos. Okay? That is the example of the sprain. What is the sign and symptoms of sprain? First is pain. Nandoon yung sakit niya. Then, next is the swelling, yung pamamaga. Then, bruising. Bruising is yung masakit. Then, limited ability to move the affected joint. Diba, once na karon kayo ng sprain, hindi mo may galaw yung affected part nito. Hindi ka makalakad. Masakit pag nilakad mo. Then, at the time of injury, you may hear a pop in your joint. Diba? Once na Yung sinabi ko naligos, di ba? Pag naligos ka, there is the sound like a pop. Di ba? Tutunog yan, mapipil mo yung pagtunog niya. Okay? That is the sign and symptoms of the sprain. What are the first aid for this? Okay? First is rest the affected area. Kailangan i-rest mo yung affected area, hindi yung nilakad-lakad mo. Mas lalong lalala yung affected part niyan. Then application of cold compress, kailangan you must put or apply the cold compress direct to the affected part. Okay, then elevate the affected area. Kailangan itaas mo yung affected area niya. Then mild sprain and strain can be successfully treated at home. Okay, severe sprain and strain sometimes required surgery to repair torn ligaments, muscles, or tendon. Okay, ito nakukuha sa paglalaro ng basketball, yung sprain and strain. Okay, that is the sprain. Is the strain. And the strain, it is the stretching or tearing of muscles or tendon. Okay, ito yung sinasabi natin, nabinat yung muscle mo or na-force yung muscle. Okay, yung parang nabigla. For example, tumalon ka, okay, nabinat yung muscle mo sa paa or sa may tendon mo, okay, that may cause the strain. What is the sign and symptoms for this? Okay, the sign and symptoms is or are the first pain. There is the pain. Okay, swelling, pamamaga, the muscle spasms, limited ability to move the affected muscles. Hindi mo siya maigalaw masyado. Okay, then first aid for this, rest the affected area. Okay, kailangan i-rest mo yung affected part na may injury or na strain. Then application of cold compress. Then elevate the affected area. Kagaya ng sprain, the same pa rin yung first aid ng strain. Kailangan you must apply cold compress. Okay? Then elevate the affected area. Parehas sila ng sprain. Yung pagbibigay ng paunang lunas. Okay? That is the strain. Then, okay, the first aid for this is stop bleeding. Apply pressure. Then, immobilize the affected area using splint. Then, the cold compress. You cannot move the affected part or area unless you will put the splint. Diba? Halangan naman na bubuhatin mo yung kamay niya, may fracture na nga. Hindi mo yan mabubuhat kasi maglulupay-pay yung kamay niya. You must put, okay, the splint on the affected area. Okay? That is the first aid for the fracture. Then you must refer to the physician and care for the shock. What are the purpose for splinting? As I said a while ago, you must put a splint on the affected area. Okay? You must immobilize the affected area. Okay, purpose of splinting, immobilize the affected area. When we say immobilize, para hindi magalaw-galaw yung affected area niya or the injured part of the victim. Then, to reduce or lessen the pain para mabawasan yung sakit niya. Then, to prevent further damage to soft tissue. Yung nga yung sinabi ko, kailangan maprotektahan yung soft tissue niya doon sa kamay or doon sa paa. Kasi once na hindi mo nilagyan ng splint niyan, it may cause worsening. Okay? Then reduce the possibility in the injured area, then prevent closed fracture from becoming open fracture. Okay, that is the purpose for splinting. To prevent closed fracture, pag closed fracture siya, pag nilagyan mo ng splint sa baba at sa taas ng kamay mo, okay, hindi na yan mag-o-open, hindi na yan mapupunta sa open fracture. Kasi nga may nakasuporta na doon sa may injured part niya. Types of splint. As you can see the picture, there are 3 types of splint. Okay, the first one is the rigid splint. Okay, yung rigid splint na sinasabi natin is ito yung mga matitigas na bagay na pwedeng ilagay doon sa injured part ng victim or yung mga kahoy, bakal, or anything. Okay, anything that are hard. Okay, next is the soft splint. Ito yung pwede kang gumamit ng unan, foam, or anything that are soft doon sa injured part ng victim. Then yung self-splint or anatomic splint na sinasabi natin, ito yung, for example, na-injury yung daliri mo at yung isa is hindi, pwede mong pagdikitin yung dalawa para maprotektahan yung isang injured part ng daliri mo. Okay, that is the anatomic splint. Pag sa paa naman, pwede sa dalawang paa, pagdikitin yung paa, okay, para masuportahan yung injured part niya. Okay, that is the anatomic splint, or that are the types of. Okay, next is the poisoning or to maim. Okay, any substance, solid, liquid, or gas that tend to impair health causes death when introduced into the body or skin surface. Okay, yung poisoning, anything na solid man yan, liquid or gas, that is intake, or once you intake, there is the cause of the death, okay, when that poison introduced to your body or to your skin. Okay, means by which poisoning occur by injection, inhalation, absorption, ingestion. Okay, that are the means, okay, when we use the poison. First is yung injection na sinasabi natin. Ini-inject sa katawan yung poison. Then, pwede nating malanghap, okay, through inhalation, through your nose. Okay, then absorption, then ingestion. Yung ingestion na sinasabi natin, ito yung paglunok natin. Okay, what are the signs and symptoms of this? Okay, nandun yung nausea or yung pagdudual, vomiting, yung pagsusuka, okay, diarrhea, then abnormal breathing. Once you are poisoning or once you are intake the poison object, okay, you have the abnormal breathing, yung unti-unti lang yung paghinga mo. Okay, inaabot mo yung paghinga mo. Then the burn to the lips. Okay, makikita mo doon sa lips mo is nag-iba na yung kulay niya. Then drowsiness, nahihilo ka. The unconsciousness, nawawalan ka ng malay. Then the convulsion, kakaroon ka na ng convulsion once you are poisoned. Then the dizziness, yung nanginginig ka na, nahihilo. Okay, that is the sign and symptoms of poisoning. Okay, how we can prevent the poison? First, you must keep all drugs and all harmful chemicals locked. Okay, kailangan yung mga drugs and anything, yung mga pesticides na ginagamit natin, all the harmful chemicals you must put on the cabinet that are having the lock. Kailangan i-lock nyo yung cabinet. Okay? Then never give medicine in the dark. Wag na wag kang magbibigay ng gamot kung hindi mo nakita kung anong klaseng gamot yon. Okay? Then read the label before taking the medicine. Kailangan basahin mo yung content ng medicine na iinumin mo or ibibigay mo sa kasama mo. Okay? For example, yung gamot pala na yon is pwede siyang magka-allergy. Binigay mo. Okay? Kailangan you must read the label before taking the medicine. Then educate children regarding danger in poisonous chemical. Okay? Kailangan pagsabihan yung mga bata na pag uminom sila ng gamot na ganito, pwede silang mamatay. Okay? May mga epekto pag uminom kayo ng ganitong gamot. Then, wag na wag nyo ipapakita sa kanila kung saan nyo nilalagay yung mga poisonous chemical nyo. Or, kailangan sabihin nyo na yung chemical na yun is nakakalason para alam ng mga bata na delikado pag ininom nila yung gamot na yon. Okay? That is how to prevent the poison. Then, another one is yung snake and spider bites. Pwede kang malason sa kagat ng ahas, okay? Kagat ng aso, kagat ng scorpion, or yung mga gagamba. Okay? Right, like the rattlesnake, copperhead. Okay? May mga geta, yun yung geta ba yun? Yung nakakalason. Venom. Okay, black widow, brown recluse. Okay. The signs and symptoms of this, okay, pwedeng karoon ng pain is immediate. Once na-bite ka ng ahas or aso, okay, the pain is there immediately. Okay, sasakit yan kaagad. Okay, severe swelling, discoloration, or nagiging cyanotic na siya. Then, weakness. Then, the rapid but weak pulse. Okay? Then, pwede kang karoon ng or magsusuka ka. Then, yung paningin mo, parang nangingitim na siya. Dim vision. Okay? Hindi na klaro yung paningin mo once na yung venom ng kagat ng ahas is napunta na or nagkalat na sa katawan mo. Then, pwede ka nang maging unconscious. Diba minsan, pag sinasabi nilang kinagat ka ng ahas, okay, talian mo mas mataas doon sa kagat ng ahas. Okay, to prevent na pwedeng kumalat yung lason na sa katawan mo. Okay? Then, first aid for this, limit the activity, constructing bandage above, as I said. Okay? Once a snake bite, okay? Once the snake bite on your hands, kailangan constructing bandage above. Talian mo, mas mataas doon sa kagat ng ahas. Then, cold application. Okay? Then after that, you may advance medical attention. Okay, kailangan pumunta ka na doon sa nearest hospital to cure yung snake bite mo para maagapan ka pa. Okay, that is the first aid for the snake and spider bites. Okay, on the dose for the snake bites or anything that may cause injection, kailangan don't give alcohol. Wag na wag niyong bibigyan ng alcohol direct. Okay, direct to the wound. Okay, it may cause dilates blood vessels. Then, don't allow the victim to walk or move. Okay, wag na wag niyong pagagalawin yung taong nakagat ng ahas. Okay? Next is the burns. Yung burns na sinasabi natin is the injury to the skin due to overexposure to heat, chemical, radiation, and electricity. Okay, that are the causes of the burns. Okay, there are 3 types or degrees. As you can see to the picture, there are 3 types of burns or degree. First is the first degree. On the first degree, okay, so you can see it is the superficial layer of the skin is the affected part. Okay? Ito yung sa may unang part pa lang ng skin yung naapektuhan. Okay? The next is the second degree or the both and second layer of the skin are affected. Okay? Yung dermis, okay, of your skin is naapektuhan na. That is on the second degree burn. You know, third degree burn, okay, that is the it affects the 3 layers of the skin. Okay? Hanggang sa may epidermis na yan ay naapektuhan na. Okay? The third degree, okay, it looks white. Okay? Yung injured part niya ay nagiging puti na. Nakikita na natin yung inner part of the skin. Then, there is no pain. Parang namamanhid na yung injured part because the nerve that transmit impulse has gone. Okay? Namamanhid na yung injured part niya o yung nasunog doon sa pang third degree burn niya. Okay? What is the first aid for this? The first aid for the first aid for the burn is with no open blisters. Pag walang open blisters, flush with lots of cool water. Apply moist dressing on bandage. Okay, pag wala siyang blisters, kailangan hugasan siya. Okay, flush with lots of cool water. Then, do not attempt to open the blisters. Huwag na huwag nyong bubuksan yung open blisters. Yung blisters na sinasabi ko, yun yung may tubig. Okay, once, di ba, pag napasok kayo, may tubig na lulobo. Okay, yun yung sinasabi kong blisters. Okay, do not attempt to open that. Okay, it may cause, pwedeng, pag once na inopen mo yung blisters na yan, pwede kang ma-infection. Okay? Baka mamaya yung blisters sa yung tusukin mo ng karayom or anything that are yung matutulis. Okay? Baka tusukin mo yan. Okay? There is a possibility na pwede kang ma-infection. Then, care for shock. Then, bring the victim to the hospital. Okay? Kung hindi na kaya ng first aid, kung bigyan na ng paunang lunas, dalhin na siya kaagad doon sa hospital. Okay? Those in the burn, do not attempt to clean the third degree burn. O wag na wag niyong huhugasan yung third degree burn. Kasi pwede yang ma-infection. Then do not apply ointment. Wag bibigyan or lalagyan ng ointment. Okay? Do not give fluid to the victim. That is the dose for the burn. The next is the seizure. Ano ba yung seizure na sinasabi natin? Ito yung nangingisay ka o yung mayroon kang epilepsy. Okay, yung epilepsy na sinasabi ko, this is the sudden involuntary contraction of muscle due to an ability to brain to control electrical impulses. Okay, that is the seizure. Okay, the sign and symptoms of this: stretching of muscles, drowning of saliva. Okay, yung drowning of saliva, yung naglalaway siya, sudden falling, natutumba na kaagad, the presence of aura or sudden signal. Then, what are the first aid for this? Okay, do not restrain the victim. Then, tie the seizure. Position the patient in a side-lying position to drain the saliva left in his mouth. Okay, kailangan pahigain mo yung nag-seizure, okay, para tutulo yung kanyang laway na naiwan doon sa bunganga niya. Okay, para tuluyang tumulo yung laway niya, bayaan lang natutulo yung laway niya. Then care for shock. Diba minsan pag may nagsisisure, nilalagyan ng kutsara. Kutsara yung bunganga na may nakabalot na panyo para maiwasang makagat yung kanyang dila. Kasi once na nakagat niya yung kanyang dila, there is the possibility na pwede siyang mamatay. Okay. Is the choking. Choking or this is the airway obstruction. Okay, when we say obstruction, okay, an object or any object na may pasok sa may bunganga. That is the obstruction. Ano ba yung nagkukos ng mga choking? Okay, when we say choking, this is the universal sign, okay, for choking is hand clutch to the throat. Diba? Pag nacho-choke ka, nakikita mo yung isang tao na yung dalawang kamay niya is nasa may throat niya. Okay, yun yung yung sign na nagkaroon siya ng choking. Okay, there are 3 types of choking: the open choke, the closed, okay, then the obstructed. Okay, on the open, yun yung mga open anything na pwedeng pumasok sa may bunganga mo. Okay, that is the open choking. The closed choking, okay, yung tongue is yung nagkukos ng pag-choke mo. Okay, if your tongue is yung nanigas siya, okay, at pwedeng sumara doon sa may throat mo. Okay, then the other one is the obstructed, or we can say that mechanical. Okay, mechanical obstruction. Okay, for example, anything na pwede mong pulutin at nilunok mo, for example, yung ballpen nilunok mo, then nagbara yan sa may throat mo, that is obstructed. Kasi anything na galing sa labas na pwedeng bumara sa may throat mo, that is the obstructed, or when we say obstructed, there is the mechanical obstructed. Okay, yung kahit na anong bagay at nilunok mo, okay, na galing sa labas at bumara sa may throat mo. Okay, that is the obstructed. Okay, what is the indication of having a choking? Okay, there is the inability to talk. Okay, hindi siya makapagsalita. Wala kasing lumalabas na hangin sa may kanyang bunganga, kaya hindi siya nakakapagsalita. Okay, then cannot breathe easily. Hindi siya makahinga ng maayos. then cannot cough forcefully. Okay? Hindi siya makaubo para mailabas sana yung obstruction doon sa loob ng kanyang throat. Then, loss of consciousness. Mawawalan na siya ng malay once na hindi natanggal yung kanyang obstructed doon sa kanyang throat. Okay? Then, the sign and symptoms of this, coughing, inability to talk, clutching his throat, yung hinahawak-hawakan niya yung kanyang throat, then wheezing, cyanosis. Okay, that are the sign and symptoms of choking. Then, how to manage the choking? Okay, check if there is an obstruction or ask the person if conscious. Okay? Kailangan, you must check the obstruction kung ano ba yung nailagay niya or nakain niya, bakit bumara sa kanyang lalamunan. Then, perform the Heimlich maneuver. Okay, Heimlich maneuver, ito yung buhatin mo siya papataas. Pabigla mo doon sa baba ng kanyang chest. Lagay mo yung kamay mo. Okay? Stand or kneel behind the person choking. Okay? Place one arm around her waist with a fist position. Okay? As you can see on the picture, nakikita nyo kung paano yung proper na Heimlich maneuver. Okay? Then after that, if the patient is unconscious, give. Okay? Kung unconscious siya, give CPR. Okay? CPR, when we say CPR, is a life-saving technique useful in many emergencies, including a heart attack or near drowning, in which someone's breathing or heartbeat has stopped. Ito yung ginagawa sa mga nalulunod, kakaroon ng heart attack. Okay? Then, yung mga heartbeat nila is nag-stop. Nag-stop din yung kanilang paghinga. That, pwede nyo ibigay sa kanila yung CPR or pwedeng gawin yung CPR. When you give CPR, if you are a first aider or you are untrained for the CPR, okay, you must provide only the hands-only CPR. Okay? Yung kamay lang yung gamitin mo sa paggamit ng CPR. Then, that means uninterrupted chest compression of 100 to 120 a minute until paramedics arrive. Okay? Kailangan pag nagbigay ka ng CPR, kailangan 30 compression at 5 beses mo itong ulitin. Okay? If you are untrained. Then, if you are trained and ready to go, okay, you must check to see if there is a pulse and breathing. Okay, you must check first the pulse and breathing of the victim. Hindi yung humihinga naman siya, conscious siya, pero binigyan mo ng CPR. No. You must check first the pulse and breathing of the victim. If there is no breathing or a pulse within 10 seconds, begin to the chest compression. Okay? Start with the CPR with 30 chest compression before giving to rescue breath. Ito yung sinasabi ko, yung 30, 2, and 5. Ano ba yung 30, 2, and 5? Yung 30, 2, and 5, 30 compression, 5 beses mong ulitin yung compression na ginawa mo, then 2 blows. Okay, after 30 compression, you must give 2 blows. Okay, that is the proper in giving compression or CPR to the victim. Then, before you begin starting, you must survey the scene. Okay? You must survey the scene as what happened. Then, is the person conscious or unconscious? You must check. Then, after the person appears unconscious, tap or shake his or her shoulder as if it is, are you okay? Okay, tanungin mo kung okay ba siya. Kung unconscious, okay, if the person doesn't respond, okay, 2 people are available, have 1 person call 911 or you must call the local emergency number, then the next assist the victim and activate EMS or what we call the emergency medical services, then go to CPR. In performing the CPR, you should know the method of ABC through LLF or yung ABC na sinasabi ko is yung air, breathing, and compression. Yun yung ABC of life na sinasabi ko. Yung LLF naman, ito yung look, listen, and feel. Okay? As you can see on the picture, on the first picture, you see the 2 people, the rescuer asking the person or the patient if he or she is okay or unconscious siya or conscious ba siya. Then, after that, yung pangalawang picture, yung kamay niya is tinaas niya yung kanyang baba, then yung kanyang forehead, he or she, the first aider must tilt the head of the victim, then after that, attempt to ventilate the victim. Give the victim with 2 blows. Okay, yung after 30 compression, give the victim with 2 blows. Okay, then after you give the 30 compression, the 2 blows, the 5 repetition, okay, you must check the pulse of the victim. Kailangan, ito, yung check the pulse, yung hinahawakan na niya yung sa kanyang lieg, kailangan yung kamay mo, while you're checking the victim, yung kamay mo dapat is, kailangan yung nasa malapit sa'yo. Hindi yung doon sa kabilang lieg niya mo ilagay. Kasi once na doon sa kabilang lieg mo nilagay, there's a possibility na pwedeng sabihin na pinatay mo yung victim. Para sabihin na sinakal mo siya. So, kailangan pag nag-check ka ng pulse, okay, use the index finger and the middle finger, ilagay nyo doon sa may malapit sa'yo. Hindi doon sa kabilang side. Okay, that is the checking on the pulse. Then, the recovery position. Okay, kailangan itaas mo yung isang paa niya, yung pinakamalayo. Then, yung isang kamay niya, ilagay mo sa kanyang dibdib. Then, itagilid mo siya. Then, tap the back of the victim. Okay, that is on the recovery position. Yung isang picture, yung tinitingnan niya yung dibdib ng biktima at yung tenga niya is nilagay niya sa may bunganga or sa nose, sa may nose niya. That is the LLF for breathing. Okay, yung tinitingnan niya ba kung umaangat ba yung dibdib ng biktima, kung may lumalabas ba sa kanyang ilong o bunganga na hangin. That is the LLF for breathing, or what we call the look, listen, and feel for breathing. Okay, that is the CPR for adult. Okay, on the CPR for infant, okay, pag nag-CPR tayo ng infant, kailangan yung dalawang kamay lang yung gagamitin. Okay, the index finger and the middle finger. Bakit? Kasi yung buto pa lang ng mga bata o yung infant is fresh pa, hindi pa yung gaanong matigas. So, kailangan yung dalawang kamay lang yung gamitin pag CPR mo or pag nagbigay ka ng compression sa bata or sa baby. Okay? Okay, that is for the infant. Okay? The same pa rin, you must give compression. Okay? Kailangan 0.5 to 1 inch lang. Okay? 2 finger, it must support by your thumb pag nag-compression ka sa baby. Ngayon, bigyan mo din siya ng 2 blows. Okay? Then, 5 beses mo din siyang ulitin. Yung kamay lang yung pinagkaiba niya. So, do not, as a first aider, wag na wag kang sasabi na patay na yung biktima. Okay, you are not the doctor to say that. Okay, kailangan you must ask the doctor. Okay, hindi ikaw yung magsasabing patay na yung biktima. Okay? Kung yung biktima ay wala ng heartbeat pero may pulso, okay? Buhay pa yon. Then, kung pulseless at wala na ring heartbeat, okay? Possible, patay na yon. Okay? So, that is the end of my discussion. Thank you for listening.